Good afternoon. My name is Jasmine Anderson, Immunization Education Specialist for Immunization Initiatives at the Partnership for Maternal and Child Health of Northern New Jersey. Thank you for joining today's webinar, How to Protect Against Seasonal Influenza. This activity is supported in part by the New Jersey Department of Health Vaccine Preventable Disease Program. At the end of this webinar, participants will be able to explain what seasonal influenza is and its risks and complications, discuss how to protect themselves and others from seasonal influenza, discuss flu vaccine benefits and myths, and explain where to get a flu shot. Influenza is an upper respiratory virus that infects the nose, throat, and lungs. It can easily spread through droplets when an infected person coughs, sneezes, or talks. It can also spread through infected objects. A person can be contagious with the flu virus 1 day before showing symptoms and 5 to 7 days after becoming infected. For these reasons, it is considered to be a pretty contagious illness. Flu symptoms can include body aches, cough, fever, chills, headache, sore throat, runny or stuffy nose, and tiredness. The flu shares some of the same symptoms with the common cold, COVID-19, and RSV, which all spike around the same time of the year, which is the winter. It is important to note that you can catch any of these illnesses at any point of the year. The best way to confirm which respiratory illness you have is through testing with a healthcare provider, or if you suspect that it's COVID-19, testing at home. This graphic is a great tool to use to help you determine your course of action should you or a loved one become ill. Anyone can develop serious complications from the flu. Those complications may include high fever and chills, severe muscle aches, headaches, severe pneumonia, which can be fatal, runny nose and cough for weeks, hospitalization, and death. As mentioned, anyone can develop life-threatening complications from the flu, but there are certain people who are at highest risk for complications from the flu. Those people include young children under the age of 5 and especially under the age of 2, those who are pregnant and up to 2 weeks postpartum, those with certain health conditions such as asthma, diabetes, kidney disease, or heart disease, and lastly, older adults ages 65 and older. Flu season is the time of year when there is typically high flu activity, meaning that the flu is spreading. Flu season typically falls between October and March. Flu activity usually peaks between December and February. However, again, it's important to note that anyone can catch the flu year-round. There is just a particular time of the year when we see an uptick in flu activity, and that time of year is the fall and winter. So you can protect yourself and your child and others against the flu by getting vaccinated annually against the flu, staying up to date with other routine immunizations, wearing a mask in public, specifically N95 masks, and practicing healthy hygiene. So that includes washing your hands regularly with soap and water for 20 seconds, disinfecting surfaces regularly, and avoiding touching your eyes, nose, and mouth with unclean hands. CDC recommends that everyone ages 6 months and older receive a flu shot by the end of October. We'll discuss more benefits of flu vaccination in the next slide, but the most important benefit is that the vaccine significantly reduces the chances of hospitalization and death in children and adults. There are different types of flu vaccines that you can get, including one that is administered as a nasal spray. There are 3 that are preferentially recommended for older adults age 65 and older. All of the flu vaccines protect against 4 flu strands. They contain 4 of the most circulated flu strands in the last flu season. Flu shots are safe and strongly recommended during pregnancy. Those who are pregnant, as we learned, are considered high risk. The reason why is because of their already decreased lung capacity. And as we learned, influenza infects the lungs. And so antibodies can be passed from the mother to the child while the mother is pregnant and while breastfeeding. The reason why the CDC recommends everyone receive a flu shot by the end of October is because flu antibodies take 2 weeks after vaccination to develop. And as we just learned, flu season typically peaks between December and March. Getting vaccinated by the end of October ensures that you are fully protected for the entirety of flu season. Lastly, it is recommended that we receive a flu shot every year because the flu viruses are constantly mutating and immunity from flu shots wane over time. This graphic shows the benefits of flu vaccination during the 2021-22 flu season. During that flu season, flu vaccination prevented 1.8 million flu illnesses, 1 million flu-related medical visits, 22,000 flu-related hospitalizations, and 1,000 flu-related deaths. These are the common side effects that we see from flu shot vaccination and from the nasal spray vaccine. Physical response or side effects are mild, they're also common, and they last 1 to 2 days. Any serious side effect is rare, but if there are any serious side effects that you or your child or a loved one is exhibiting, you should contact a healthcare provider as soon as possible. So flu shot side effects include soreness, redness, or swelling at the injection site, low-grade headache, fever, nausea, muscle aches, fatigue, and occasional fainting, which happens with other immunizations too. Nasal spray side effects include runny nose, headache, wheezing, vomiting, muscle aches, low-grade fever, all of which are commonly seen in children, sore throat, and cough, those last two commonly seen in adults. You always want to consult with a pediatrician before giving any pain reliever or fever-reducing medication to a child. Here's a list of places where you can get a flu shot: your doctor's office, your local health department, a pharmacy. That can be a local pharmacy or a retail pharmacy, such as Walgreens, a public health clinic, and a federally qualified health clinic. Most places offer the flu shot for free because these vaccines are recommended by the Advisory Committee on Immunization Practices, or ACIP. These vaccines are covered, the flu shot is covered by all insurance companies and are available free of charge at certain locations for those who are uninsured or underinsured. Not all health departments offer flu shots for free, so be sure to ask if there are any costs to receive a flu shot if you are looking to get one from a local health department. However, if you visit a public health clinic or a federally qualified health clinic, flu shots are free of charge. This week is National Influenza Vaccination Week, and every year this week serves as a reminder to everyone 6 months and older that there is still time to get vaccinated against the flu. So if you haven't gotten your flu shot yet, it is not too late. As of today, the CDC estimates that there have been at least 1.8 million flu illnesses, 17,000 flu-related hospitalizations, and 1,100 flu deaths so far this season. And as we just learned, the flu shot is effective in preventing flu-related hospitalizations and deaths. So again, it is not too late if you have not received your flu shot. Hand washing has proven to be an effective way to slow the spread of illnesses and killing germs. It's important that we are all washing our hands regularly, including children. And so here are some instances from the CDC when we should absolutely be washing our hands. Anytime we are touching food, anytime we are caring for someone who is sick with vomiting or diarrhea, or just sick in general. Anytime you are before or after treating a cut or wound, after using the bathroom, after changing diapers, or after cleaning up after a child who has used the toilet, after blowing your nose, after coughing or sneezing, especially if you sneeze or cough into your hands, after touching an animal, animal feed or animal waste, after handling pet food or pet treats, and after touching garbage. Proper hand washing technique is essential. I want to draw our attention to number 4, about scrubbing our hands for at least 20 seconds. That is essential that we all are doing that. If you need a timer, you can set a timer on your phone. You can count. For children, you can sing a song. For children, you can teach them hand washing songs. There are fun ones that they can learn, but it is important that we are washing our hands for the full duration of 20 seconds. It's important to note that hand sanitizer is not as effective as washing hands with soap and water. It can be used if soap and water are not readily available. However, you should definitely wash your hands as soon as soap and water are readily available. So let's review some myths and facts about the flu. Myth number 1, you can catch the flu from the vaccine. This is false. The flu shot is made from an inactivated virus that can't transmit or cause infection. The piece of the pathogen that is in the flu shot, which is the inactivated virus, it is only meant to teach your body how to recognize the actual flu virus should you encounter the flu virus later on. So what happens when you get the flu shot? Your body develops an immune response. It develops memory T cells as well as antibodies to fight off the flu virus, which is why we feel ill after receiving the flu vaccine. But again, that's not you being infected with the flu. That is just your body developing its immune response should you encounter the flu virus later. And so when you do, or if you do encounter the flu virus later, your memory T cells will remember and will develop those same antibodies so that you can effectively fight off that flu infection, which then prevents hospitalization, the complications, and death. Myth number 2, the flu is just a bad cold. This is false. The flu is not the same as the common cold. It can be far more serious. And as we learned, the flu causes millions of illnesses, hundreds of thousands of hospitalizations, and tens of thousands of deaths in the US each year. Myth number 3, you do not need to get a flu shot every year. The influenza virus changes or mutates every year, and so the flu vaccine is updated yearly, so we do need a flu shot every year. Additionally, immunity from the flu vaccine wanes over time, so annual vaccination is critical to provide the best protection. And myth number 4, healthy people don't need a flu vaccine. Anyone can get the flu and develop complications from flu infection, including young, healthy people, children, and babies. There's a lot of misinformation and disinformation out there, so be sure that you are getting your information from trusted sources. Here is a list of trusted sources whose websites you can visit to get more in-depth information about everything we discussed in this presentation today. And so that is the end of the webinar. Thank you all for joining me today. This is my contact information. Should you have any questions regarding the flu vaccine, or you need assistance in locating a flu shot. Remember that we have the power to protect ourselves against the flu. So protect yourself, protect others, get your flu shot today.